Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cytomegalovirus Infections. Introduction. Cytomegalovirus, also known as CMV, is a virus found around the world. Once CMV is in a person's body, it stays there for life. Most people with CMV don't get sick, but infection with the virus can be very serious in babies and people with weak immune systems. This program explains what cytomegalovirus is and what causes it. It also explains how the illness is diagnosed and treated. Cytomegalovirus. Cytomegalovirus, or CMV, is one of the herpes viruses. This group of viruses includes the herpes simplex virus, varicella zoster virus, and Epstein-Barr virus. CMV can cause serious disease in people with a weakened immune system, such as cancer patients, HIV patients, organ and bone marrow transplant recipients, patients receiving immunosuppressive drugs. Immunocompromised patients who are concerned about CMV should consult their physicians about the best ways to avoid problems from CMV infection. Symptoms. Most healthy children and adults infected with CMV have no symptoms. They may not even know that they have been infected. Some people may develop a mild illness when they get infected and have the following symptoms: fatigue, fever, sore throat, swollen glands. Since these are also symptoms of other illnesses, most people don't realize that they have been infected with CMV. Cytomegalovirus can cause serious disease in babies who are infected with CMV before birth. This is known as congenital CMV infection. Children born with congenital CMV infection may develop permanent problems such as hearing loss or developmental disabilities due to the infection. Infants and children who are infected with CMV after birth rarely have symptoms or problems. Signs of CMV infection that may be present at birth include liver problems, lung problems, premature birth, seizures, small head size, small size at birth, spleen problems. Permanent health problems or disabilities due to congenital CMV infection include death in rare cases, hearing loss, lack of coordination, mental disability, seizures, vision loss. Children with congenital CMV infection are more likely to have permanent disabilities if they had symptoms of CMV infection at birth. However, some children with congenital CMV infection who appear healthy at birth can later develop hearing or vision loss. If you know your baby was born with congenital CMV, it is important to have his or her hearing and vision tested regularly. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. CMV is spread by close contact with an infected person's body fluids. Examples of body fluids include blood, saliva, urine, or breast milk. The risk of getting CMV through casual contact is very small. CMV can also be sexually transmitted. The virus is generally passed from an infected person to others through direct contact with body fluids, including semen and vaginal fluids. Rarely, it can also be spread through transplanted organs and blood transfusions. CMV can be transmitted from a pregnant woman to her fetus during pregnancy. CMV does not harm most babies, but some develop lifelong disabilities. Young children often become infected with CMV in early childhood. Childcare and preschool settings where there are many children allow CMV to spread easily. People who are infected with CMV can shed the virus, which means pass the virus to others through their infected body fluids. Young children often shed CMV for months after they first become infected. Parents of children who are shedding the virus can become infected from their children, but this is not common. Less than 1 in 5 parents of children who are shedding CMV become infected over the course of a year. Although CMV can be shed in breast milk, infections that happen from breastfeeding usually do not cause symptoms or disease in the infant. There are no recommendations against breastfeeding. CMV infection after birth may cause disease in very premature or low birth weight infants. Mothers of these infants should consult their healthcare providers about breastfeeding. If you have concerns about CMV infection and are pregnant or planning a pregnancy, talk with your healthcare provider. Diagnosis. If you have the symptoms of CMV, your healthcare provider can use certain tests to determine whether you have the disease. Your healthcare provider may take a blood sample to look for proteins in your blood called antibodies, which your immune system creates in response to CMV. Other tests detect the virus itself. These tests may require another sample of blood or other body fluids. Sometimes a tissue sample is needed for testing. When tissue is removed from the body for testing, it is known as a biopsy. Tests that detect the virus are used to determine if a person has an active CMV infection. If the virus is detected in the blood, saliva, urine, or body tissues, it means that the person has an active infection. Healthy pregnant women are not at special risk for disease from a CMV infection. A single test cannot rule out CMV infection during pregnancy with 100% accuracy, especially if testing happens after the first trimester. Women who are concerned about CMV infection during pregnancy should consult their healthcare provider. Tests that detect the virus are used to diagnose congenital CMV infection. A diagnosis of congenital CMV infection can be made if the virus is found in an infant's urine, saliva, blood, or other body tissues within 2 to 3 weeks after birth. Antibody tests cannot be used to diagnose congenital CMV. A diagnosis can only be made if the virus is detected within 2 to 3 weeks of life. Congenital CMV cannot be diagnosed if the infant is tested more than 2 to 3 weeks after birth. Healthy infants are not routinely tested for CMV infection. If you find out that you became infected with CMV for the first time during your pregnancy, make sure your infant is tested for CMV as soon as he or she is born. If your infant is diagnosed with congenital CMV infection, you should have his or her hearing and vision checked regularly. Babies infected with CMV after birth generally are not at risk for problems unless they were born very prematurely and have very low birth weights. Treatment. Currently, there is no cure for CMV. Treatment for the virus is often not needed or recommended for healthy people. This includes healthy children and healthy adults. Treatment is needed for newborns and people with compromised immune systems when they experience symptoms such as pneumonia. Treatment depends on the symptoms and how severe they are. Talk to a healthcare provider to learn more about these symptoms and their treatment. Antiviral medications are often used when treatment is needed. These medications slow down virus reproduction, but the treatment cannot destroy the virus. Once a person has CMV, they have it for life. Complications. Rarely, CMV can cause healthy people to become sick. When this happens, the infection may cause complications. CMV infection rarely may cause the following complications in healthy people: CMV mononucleosis, intestinal complications, liver complications, lung complications, nervous system complications. CMV mononucleosis, or mono syndrome, is similar to infectious mono. Classic mono is caused by a different virus called the Epstein-Barr virus, or EBV. If you have symptoms that resemble mono, such as sore throat or swollen glands and tonsils, your doctor will test you for the EBV antibody. If it's absent, there's a good chance CMV is causing your symptoms. CMV infection in your intestines can cause abdominal pain, blood in your stool, diarrhea, fever, inflammation of your colon. CMV can cause abnormal liver function and an unexplained fever. Many different neurological complications have been reported as a result of CMV infection in the nervous system. These may include inflammation of your brain, which is known as encephalitis. CMV can cause inflammation of your lung tissue, which is known as pneumonitis. Complications caused from newborn CMV infection include attention deficit hyperactivity disorder, or ADHD, autism, death, eye abnormalities including central vision loss and others, hearing loss, lack of coordination, mental disability, seizures, small head size. Talk to your healthcare provider if you are concerned about complications from CMV infection. Many of these problems can be treated. Prevention. CMV infection in healthy people is common and rarely causes symptoms. Efforts to prevent the spread of CMV are not necessary for most groups of people. Pregnant women and people with weak immune systems may want to take steps to reduce their risk of exposure to CMV. The following reviews some simple steps these people can take to avoid exposure to saliva and urine that might contain CMV. Wash your hands often with soap and water for 15 to 20 seconds, especially after changing diapers, feeding a young child, handling children's toys, wiping a young child's nose or drool. Do not share food, drinks, or eating utensils used by young children or other people. Also, do not put a child's pacifier in your mouth. Do not share a toothbrush with anyone, especially a young child. Also, avoid contact with saliva when kissing a child. Be careful when throwing away used tissues, diapers, or other items that have body fluids. After handling these items, do not touch anything, especially your face, until you wash your hands well. Clean toys, countertops, and other surfaces that come into contact with children's urine or saliva. Clean toys, countertops, and other surfaces that come into contact with children's urine or saliva. Wear a condom during sex. This can prevent the spread of CMV through semen and vaginal fluids.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cytomegalovirus, also known as CMV, is a virus found around the world. Once CMV is in a person's body, it stays there for life. Most healthy children and adults infected with CMV have no symptoms. They may not even know that they have been infected. Others may develop mild flu-like symptoms. CMV can cause serious disease in people with a weakened immune system, such as people with HIV or AIDS. It can also cause serious disease in babies who were infected with CMV before birth. Tests used to diagnose CMV may require a sample of blood or other body fluids. Currently, there is no cure for CMV. Often, no treatment is needed. When treatment is needed, antiviral medications are used to slow down virus reproduction. Thank you for using Explain.